I'm Fallon. I'm the beauty director at New Beauty Magazine, and we are tuning in today with Dr. Levine. Before we dive in, I want you to introduce yourself. Let everyone know where your practice is, and are you doing any telehealth right now or anything like that we should know?
I'm Dr. Jennifer Levine. I'm a facial plastic surgeon on the Upper East Side of Manhattan. And yes, we've been doing a lot of telemedicine, so I've really learned to use Zoom very well. We had a couple of very nice consults even this morning and a few more this afternoon. And I find it's such a great way to be able to connect to people. And I really miss seeing patients. I miss seeing my patients, and I've met some new patients. So it makes you really feel good to connect to people.
You know, thinning hair is such a big topic right now because I think there are a lot of people who are experiencing thinning from the stress that we've all been undergoing lately with the COVID-19 crisis. And so what are you finding that you are hearing are complaints from patients, and is that one of them?
Well, certainly thinning hair, but it's not only the hair on our heads. It's also, eyelashes is also like a big concern for people, because a lot of people are used to getting lash extensions and stuff like that, and they can't do it anymore. And also, our eyelashes and our eyebrows are kind of susceptible to the same stresses as go on our head. So yeah, I definitely think that hair is an issue on everybody's mind. And unfortunately, that's like one thing we can look at, like in the shower on our brush, when we see all of this hair, it's concerning. So stress is certainly something that can cause more hair to fall out. It is perfectly normal to lose between 50 and 100 hairs per day. That's part of the normal cycle. So some hair loss is normal, but obviously if we're losing more than usual because of the stress, then that's normal too at this time.
So part of the research from the story that I worked on with you last year, I discovered that the American Academy of Dermatology actually says that 40% of women will experience hair loss by age 40, which is crazy scary.
A lot of what we know about hair loss has to do with a production of androgens, which is why men often lose their hair a lot. And as women go through changes in their hormone levels, it's normal for it to affect hair loss as well. And that's the same reason why stress can increase the amount of hair loss also, because stress is going to take one of our other hormones, cortisol, and it's going to change like the balance of our hormone levels and push it more into an androgen type of hormonal production, and that's going to lead to more hair loss. So that's kind of like the mechanism of why that happens and why that increases more in stress. The other thing that's going to obviously affect our stress level is, we're not all eating the same way as we can. So when we're not getting the vitamins, that's also going to lead to hair loss, specifically, iron, B12, the folates, because like, what are we eating? One of my big stresses is like, how am I getting my groceries? So we can't even get like all the items that we want and in the same way that we get them. So it's very important for people, if they can, to be taking at least a multivitamin, or make sure that they're either getting enough iron through their diet or otherwise taking an iron supplement.
On the supplement topic, so you said iron and then and vitamin D.
Vitamin D.
And
B12,
what were the other ones for hair?
B12, folate, biotin. There's a lot of different supplements that can really help. Traditionally, like the biotin and the folate, there's a lot of other proprietary ingredients that some of these hair supplement products also have in them. So depending on which one you're using, they all have like some proprietary compound, but those are the heavy hitters.
If someone starts taking a supplement, how long until they can see results?
With the hair, it's usually going to take months. So it might take, 3 to 4 months for it to really have an effect.
I think you are a fan of Nutrafol.
Yes, that's the one that I use, and I find that to be the most effective for me. There are other brands, but that's the one that I kind of like the best.
So I actually have one here. This is what it looks like. And this one says that you have to take 4 pills a day, and it says that you can see results in 2 months. So would you say that with this one, that's pretty accurate?
Yes, I would say like I have some, yeah, it's not a small pill. I personally take all 4 of them at night because vitamins tend to make me like slightly nauseated. So I don't find that I can usually take them during the day. I would say I have had some patients see results after about 30 days, but I usually tell patients that, like anticipate it could be like 3 to 4 months. The first thing that I think people notice before they notice the hair growth is that they are losing less hair. So that's kind of like the first step, that you lose less hair, and then you kind of notice that more of it is growing, and the hair that's growing is like thicker and fuller.
So I was, blow drying my hair the other day, and I had what looked like it could be more than 100 hairs on my floor. And I was wondering if that's like, maybe it's more right now because of the stress, or if that's like, because a lot of people wrote to me after I posted that and said that they could make a wig out of the hair on their floor after they blow dry their hair.
So important to remember a couple of things. One is that our hair is like in a natural cycle. So it is going to fall out, and some of it tends to fall out like a little more when we're doing something like that, because the hair is like finished growing, it's finished its resting stage, and that kind of loss is called effluvium. So we lose the hair. The other thing that can happen when we're brushing or we're styling our hair is the hair isn't falling out, but it could also be breaking.
Right.
So I think it's important at this time to kind of like be gentle with the hairstyling tools, like maybe use less of them so the hair has less of a tendency to break. If possible, this would be, be mindful of like which shampoo you're using. Some of these sulfate-free shampoos I think are a little bit better for your hair. And also pay attention a little bit more to the scalp, because that's where the hair is going to grow from. So maybe doing a scalp treatment or something like that, because the follicle of the hair from where it's going to grow is going to come from the scalp. So we want to make sure that we all have healthy scalps, don't have dandruff or other conditions that could also interfere with hair growth.
On that note, we're seeing a lot of scalp products flood the market right now. That was like the big trend in 2019, and we're still seeing brands coming out with full collections just for the scalp. How important is, like you just said, the micro circulation that you can get with like a scalp scrub or a hair oil that has essential oils in it?
Some of the essential oils are very helpful for hair growth, like rosemary oil in particular. And there's a bunch of other ones. I think that also the massaging of the scalp is good. If you don't have a scalp mask and you're just using your regular shampoo, I would say use a sulfate-free shampoo, and really make sure that you don't need to clean this part of your hair as much as you do need to clean your scalp. That's really where we want to concentrate it. And I think that's like also what feels so good when we go to the salon, because they really massage our scalp. So I think it's important for people to remember to do that.
How big of a role do genetics play in hair loss?
They do play. I mean, especially with male pattern baldness in particular, that is like a maternal mitochondrial gene. So it's directly related to like if you're a guy, your mother's father will give you a very good idea of how your hair is going to look. So there is definitely a genetic part of it that's going to occur, especially with men. And because this androgenic component, there probably is a gene for it, but in women, I don't think it's as well studied as it is for men.
That's interesting, because I think the same thing goes for like minoxidil and Rogaine. Like a lot of those studies have been on men over the years. And do you think that's something that's going to be changing now?
Yes. Yes. So I think that there's so many studies, like even the studies on heart disease were all done on men. And we know that women have totally different symptoms and may be just as susceptible to heart disease as men. So we really have to pay more attention to what's going on with women. And we have to do the studies, because yes, these studies are all done on men. You look it up and there's all the pictures of all the men and their patterns. And it's like, I don't know how women didn't realize they were losing their hair. But I think, also that being said, even if you look back into the 1960s, when women got older, they kept their hair shorter. They didn't have long hair anymore. So there must have been a reason why people were like, oh, they probably didn't like the way their hair looked. So there was other reasons. But now that we're we're more on top of things. So yeah, we'll be doing more studies on that for women.
I know we need to do a
This,
lot
like,
more
male
studies.
pattern baldness with all those little pictures. It's like,
I know.
hello.
So, speaking of Rogaine and Minoxidil, are there any other prescription drugs that women can take?
So the spironolactone is the one that would be traditionally supplied for women. The finasteride is the one that we would prescribe for men. The spironolactone is also going to interfere with these androgen productions. It's also used for women who have like polycystic ovarian disease because it's going to kind of change the way the hormone levels are. Spironolactone is like a mild diuretic, but it really, in most people, doesn't have a true diuretic effect. But it's going to affect the androgen productions, that's how it leads back to the hair.
So if you're pregnant or trying to get pregnant, you should not take these drugs because of the hormone interaction.
No, that is correct.
Okay.
That is correct. We don't want to, when we're pregnant, we do not want to do that. And interestingly enough, when most women are pregnant, because there is an increased amount of circulating blood volume, most women actually report that their hair looks pretty good when they're pregnant. It's after delivery when there's a loss of that, and the fluctuation of the hormone levels again leads to this tremendous effluvium. So a lot of people who are postpartum will notice that they lose a lot of hair, which is like just adding to your stress of the new baby and adjusting, and then you lose your hair. So
for post-pregnancy, how long until your hair gets back to normal?
I mean, I think it depends on the person, and also if you're breastfeeding, because that will also change. But probably also it could take like 6 months. It's not forever.
Yeah, that's a lot for someone to handle who just had a baby. And then I've heard that from a lot of my friends. It's a lot to deal with.
Well, because when you were pregnant, your hair looked pretty good. So that was like one thing you could count on. And then after you have the baby, you're already not getting any sleep. And then you all of a sudden are in the shower after the shower. If you finally get into the shower with the small baby and then you're losing your hair, it's like, it's just one of those things. But it does come back. There's also been some studies about using Minoxidil combined with Latisse for hair. Latisse is the product that's traditionally used for the eyelashes. Mm-hmm. So that would be like another topical product. And obviously, the PRP or the PRF injections are something that's also very helpful in regrowing hair.
That's what I was just going to get into, actually. I was going to say, so I kind of have to preface PRP by saying that, for our audience, we have a lot of doctors like yourself who are big advocates of PRP, but then we also have a lot of doctors on our board who are hesitant about PRP because it's just lacking some scientific data and some testing. Yes. So I just want to preface by saying that, PRP is not, a cure-all for everyone, and it definitely takes a skilled doctor. So, and, I'd love to hear kind of your take on what PRP is and how it's used for thinning hair.
So PRP is platelet-rich plasma. So what you're basically doing is drawing blood from the patient, and then you're spinning it, and then you're going to inject the concentration of, if it's PRP, of just the platelets and some of the growth factors and things like that are helpful for the growth of hair. And the PRF also has fibrinogen and some stem cells, so there's thought that can actually even increase it even more. Obviously, these ideas of growth factors or stem cells are not something that are entirely proven, or it is a more controversial subject, but because you're injecting your own body's stuff, I do feel that it is safe, and I have been successful with it.
In terms of females versus males, is it more successful in your opinion on males?
That's what some people say, but I have found it successful in both groups of people. I think that patient selection is very important. So if you have someone who's in the earlier stages, it seems to work better. I've also found it to be very helpful for women who are growing out their extensions, or have had, braids or some other stress. Like if you pull your hair back very tightly, that could also be a way that will increase the amount of hair loss. I think Kourtney Kardashian had a segment on that. She wore a tight ponytail, and then she went out to get PRP. So certainly some of the things that you do to your hair over time might increase hair loss. And for those women, PRP injections can also be helpful. women who just have thinning hair due to hormonal changes, or a whole bunch of factors. But people tend to like it because it is natural and safe, and it is effective.
So how many injections are needed, and for men versus women or anybody? And is it just one round of injections, or do you need multiple maintenance treatments?
So you're going to need a minimum of 3 sets of injections. They're going to be 1 month apart. And when we draw it, I kind of will make little micro injections along the areas that we want to really make sure that we add the hair to. For me, around this is called the temporal line, is extremely important, going back by the part, because a lot of times people will notice that their part actually widens, or if you look down at the top of their head that they'll lose hair. A lot of times for men, it is a little more of an occipital or back of the hair pattern. I usually recommend that people don't wash their hair for 24 to 48 hours, because each one of these injections is kind of like a little micrograft, and we don't want to disrupt them. And then the first time that they wash their hair, they should just wash it gently with, usually I tell them, like baby shampoo. They're going to see results usually by the time they're doing their 3rd treatment, so after about a couple of months, and their maximum probably result might also be at 6 months. And for those people, you might want to do like a little booster. It just depends on the person.
Do you numb the scalp beforehand, and then is there any pain afterward?
I don't usually numb the scalp, because as I don't want to have to clean off the numbing injection afterwards, because I don't want to really rub the area. So I usually give people just like a little squeezy ball. We give people some acupressure, and it's pretty well tolerated. And it's a very, very tiny little injection. So there's no negative side effects other than the fact that it can be a little uncomfortable when you're doing the injection, but it's basically your own stuff. So it's not.
I always like to say this because I think it's very important. Now with PRP, we're seeing a lot of Groupons and things where, these doctors are offering specials and things like that. And I think, there may be a place for that somewhere. I don't want to diss all of them, but I think that this is one procedure, and I hope you would agree that you have to go to a board certified doctor who specializes in it, and really knows what they're doing.
Absolutely. Because you want to make sure that there are no additives or anything that's not right in these little tubes when you're taking the blood out. And, obviously it is your blood, so you want to make sure that you're going to someone who really understands this procedure. And I think just in general, I think it's just important to go to a board certified doctor, because doctors really think about things differently than other people. And you want to make sure that things are clean and sterile.
Anybody that's taking your blood, you want to make sure that it's, safe and sterile, and the person is, skilled in that procedure. So, okay, someone just asked PRP versus PRF, which was actually my next question.
PRP is platelet-rich plasma. PRF is platelet-rich fibrin, which is also going to so basically in the tube, there's something in it that doesn't allow the breakdown of this fibrinogen. So it adds to the scaffolding of these growth factors, and you're also able to have a higher concentration of the platelets and the growth factors, and even some stem cells. So it's thought to be more effective. In my office, we do use a PRF system. So we find that to be very helpful.
I've also heard that PRF can be longer lasting. Is that true?
We've had a lot of success with it, but since I haven't done a study that actually compares the two, it's hard to say, but we've had a lot of success with our system.
And so then if people can't, if PRP is not the answer, or all of these things that we've talked about so far don't work, there are surgical solutions, which I think everybody knows them by the name hair transplant. Which seems kind of like an antiquated name at this point, even though that's still technically what they're called. But I just was wondering if you could tell everybody kind of who is the candidate. Like, at what point do you have a patient where you're like, nothing's working, I think you should get a transplant? And what are the options for men and women?
So if the patient has really either lost a lot of hair, or they have the particular pattern of baldness that they know that they're going to lose hair, a lot more hair over time, then it would be a good idea to do one of these procedures. What these procedures are going to do is it's going to involve either harvesting a strip of hair from the back of the head or just different units. And then someone goes under a microscope and breaks up the hairs into what we call follicular units. So the way our hair is divided is sometimes there's one hair coming out of a follicle, sometimes there could be two, sometimes it could be three. So it's kind of separating these little follicular units and then creating a natural pattern and then making little microcuts and kind of planting them in place. So it involves harvesting and then planning where you're going to place them and then putting them into place.
So how long from the time that you start harvesting to the time that the person sees more hair?
So initially when the hairs are kind of planted, you could see something, but then the hair does go through a stage of effluvium where you lose all the hair that's planted, and you might actually even lose the hair in the surrounding areas because the surrounding hairs may be affected by it. So you actually lose a bunch of hair, and then you usually around 6 months is when you're going to see more hair.
Okay.
There are other more extensive procedures for people who really are completely bald that involve flaps or possibly tissue expanders, but those are we really don't have to get into because most people aren't really doing that. But let's say if you had a man and there was like a huge bald spot that they wanted to be covered, then you can actually like take a flap and move it into that area from a hair bearing area. So that's probably beyond the scope of this.
So how many surgeons like yourself are still doing these procedures by hand, and how many are using the new robotic
Most
devices?
people are using the robotic ones. It's really otherwise very time consuming and you need a team of people. So without the robotic part, it's really almost impossible to do. This is like a very technician dependent. You need someone to be harvesting the hair, splitting it up, then planting it. So it's like a whole team, and it's best probably robotically.
Okay. And I read somewhere that I think when I was writing that story with you last year that you a lot of doctors recommend to do this procedure in the winter because you can't expose the area to the sun for a little while after. So do you find that that's the case with many of your patients?
I think in the winter it's usually easier. Yeah. I mean, in the summer, obviously you're going out, you're sweaty. It's just not the best time. But yeah, most people do it, I would say, starting in the fall, late fall to winter.
You were explaining how you take the hair from the back. There was a contestant on The Bachelor a couple years ago who had a strip of, like a scar across the back of his head. And a lot of people were like kind of calling him out on Instagram. And it, made me feel bad because I knew what it was from. And people were like, oh, he had a hair transplant, So are there any technological advances that are going to help hide that in the future, or is that always going to be there?
No, I mean, a lot of what goes into scarring has more to do with incision planning and closure. So if the scar is closed under a lot of tension, it tends to form a wider scar. And also the way that you bevel the incision, meaning that you want to be able to let the hair follicles grow through the area of the scar. So there are techniques that you can use when you're planning those incisions that will allow the hair to go through the scar and not have such a widened scar. But obviously, like if you look carefully on anyone, there could be a scar, but it shouldn't be that visible. But that has to do more with planning. You have to know how much you can close without it under tension, because an incision under tension, that scar over time will widen. And then if there's no hair going through it, then it's more visible.
What about those laser hair caps? So I know I think it's called low level light therapy.
Yeah. So those are going to work by basically increasing the blood flow to the scalp and maybe decreasing some inflammation. Again, these are not things that we have like a huge amount of research on. I mean, there are some other companies that are trying to also use their light-based devices and see if there is a hair application to them. So there certainly is more research on this coming. Again, I don't think it's going to be harmful, but there's not like a tremendous amount of data that says, wow, this is really effective.
Okay. I know, because those devices are really cool. They're just expensive. So I think you have to make sure you're the right person for it first before you make the investment. And then also, I read that vegetarians, I think we covered this in the story too, that I keep referencing, that vegetarians and vegans tend to have a little bit more thinning than non because they don't get as much protein as
it's the
so that's true.
It's the iron that's more of an issue.
Iron.
So it's very important if you're a vegetarian or a vegan that you make sure you get adequate iron, which is not so easy. And the thing about iron is, in order for iron to be absorbed well by our gut, you actually have to take it with vitamin C. So either you have to buy one that has vitamin C with it, or every time you take a capsule, you should take some vitamin C because it increases the absorption of iron. So iron is something that is not well absorbed through the gut unless it is, you're eating it with a food, or otherwise you need the vitamin C carrier. Also, for the same reason, like you have to make sure that you're getting the vitamin D, that the B12, the folate. So depending on what your diet is, if your diet does not include all of the nutrients, it is going to lead to thinning hair. So it's just, you need to be more mindful of that.
Okay. Do you think hormone replacement for women in menopause helps? And I'm guessing helps with thinning hair.
I'm sure that it does, but hormone replacement in women, postmenopausal is controversial because the same reason, if, we don't want to increase the incidence of breast or ovarian cancer, cervical cancer. So that's something that should be, very closely discussed with your doctor, because that's just an individual issue, and it may be associated with other issues.
What is the typical cost per treatment? And I never usually ask this because I think it's important to tell everyone that depending on the region and the country that you live in, the doctor you're seeing, their skills, their experience, the price always changes. But is there any range you can share?
I would say that it probably could be around, $1,000 to $1,500 per treatment, depending on the area. You need at least 3 of them. So sometimes there's a little bit of a discount if you do more than if you buy it as a package. But I think it depends on the area of the country, and if you're doing the PRP versus the PRF and things, and the skill of the doctor.
Okay, well, is there anything else that I missed or that you want to add about the topic, or anything that you...
So, no, I just think that, I think it's really important for people to remember that stress reduction is actually really important for this whole process, whether it's our hair loss or in general. Like, I like to do yoga, but even a couple of minutes of mindfulness or meditation, or breathing or something, just to reduce their stress, or just be aware, acknowledge that this is a stressful time. We're all going through something that hopefully we'll never go through again in our lifetimes, and being accepting and understanding that the hair will grow back, this will end, and we'll be on the other side soon.
I've been telling myself that too, just that, I did a meditation yesterday morning, and it really helped start my day on a better foot.
I'm not really good at it, but I've been trying to look at all of these different yoga apps, and some of them have they don't even call it meditation, they call it mindfulness. And it's fine because it's 7 minutes, 10 minutes, it's guided. It's okay. I think we could all do something like that. And even if it gives us just even a couple of minutes or a different way to focus, I think that's, very helpful. And I think it's doable. Instead of saying you have to sit in a room and do it for 20 or 30 minutes, 7 minutes, 5 minutes.
Yeah.
Whatever you can do. Perfect.
Well, thank you so much.
This was fun. Much, Britt. And congratulations on your issue again.
Thank you.
Everyone should definitely look at it, pick it up, or I think it's available digitally, right?
Yep, you can get a digital issue through the NewBeauty app, which is on Apple Newsstand. And because we're quarterly, we're on stands for about 3 months. So if this is over and, you can get out to a store safely, please check it out. So we appreciate you coming on today, and I hope you stay safe and healthy, and I hope I get to see your face soon in New York.
I hope we'll see you soon too.